don't want our blood sugar to go over 140, ideally not over 130 or 120, right? The lower we keep it and the faster it comes back down, the less oxidative stress that is better for our mitochondria. Next, antioxidants, right? Antioxidants are going to be things that stabilize free radicals. Antioxidants mean they prevent oxidation. So oxidation is a loss of an electron. And so antioxidants are essentially redox agents. They give off an electron. And so it gives off an electron, which allows that cell that's missing an electron, it stabilizes it. And so that prevents oxidative stress. Think of oxidative stress as like rusting. If you cut open an avocado or like an apple and you leave it on the table, it gets brown. Okay, that's oxidation. Think of the rusty nail outside. Now, if you go squeeze, let's say, some lemon juice on it, the vitamin C in there will actually preserve it. Go try it. Cut open an avocado, take the other half, cut it open, and add a little bit of lemon juice to it, and you will see the lemon juice one does not brown nearly as much. And so our body has this kind of oxidative stress thing happening mechanistically inside of it, and that can cause lots of damage to the vasculature and to the body, to the mitochondria. And so we use things like antioxidants like vitamin C, fat soluble vitamin A, vitamin E, really good. Vitamin E is great for the arteries. You could also do things like green tea. You can also do things like turmeric or curcumin. Resveratrol. Resveratrol activates the sirtuin pathway, which is an anti-aging pathway, which is excellent if you want to live a long time. You can also optimize those same pathways by keeping your blood sugar in check as well. Metformin also activates that same pathway, which is a blood sugar kind of sensitizing compound. So antioxidants, good. Now, again, part of a nutrient-dense, anti-inflammatory, low-toxin eating plan, like I talked about diet-wise, a paleo template kind of fits into that. A paleo template is just eating a diet that's evolutionarily appropriate, meaning we're not eating Neolithic foods, processed grains, processed sugar, junky processed fats that we typically would need. It's just taking foods that are Neolithic, processed, and trying to eat foods that we have evolved to eat for a long period of time. My kind of old adage is old foods do not cause new diseases. So healthy grass-fed butter or olive oil or coconut oil, they're not going to cause disease. They've been around too long. Healthy protein sources, healthy vegetables, not going to cause disease. Now, there are some people that are sensitive where they have leaky gut permeability, sensitive autoimmune issues, or they have gut imbalances. They may have to tighten up their diet. They may have to pull out autoimmune foods. They may not be able to handle, like, let's say, some grass-fed butter. May not be able to handle eggs or even FODMAPs or histamine, but that's a different situation. That's someone's immune system due to gut issues is hyper-regulated due to gut permeability and autoimmune tendencies. That's a little bit different, though. And then, of course, stress management, because when you're not managing stress, whether it's physical, chemical, and emotional, and all these things I mentioned could plug in and create stress. When I say stress, your body fails to be able to adapt to it, whatever that thing is, and it's producing cortisol or adrenaline to help your body manage it. And if you're prolonging that stress response and you're chronically producing lots of cortisol, chronically producing lots of adrenaline, you're creating anxiety or mood issues, that's going to cause your body to deplete nutrients. When you're chronically stressing on the cortisol side, you will actually pee out your potassium. You will use up B vitamins. You will use up magnesium. If you're a female, you will deplete your progesterone. You will lower your dopamine. You will turn it into adrenaline. Chronically depleted dopamine will increase prolactin. Increased prolactin will throw off a woman's cycle. Chronic stress and cortisol can actually increase your blood sugar. That can increase aromatase in guys and cause more estrogen. In women, it can create testosterone imbalances, increase androgens, and that can cause PCOS and infertility, and then hair on the jawline for a female. So not good.